Hello everyone. It is an honor for me to be able to stand here and share my thoughts today during this amazing TEDx event. And thank you so much for everyone for attending. So, the topic of my talk today is the essence of curiosity. Well, what is curiosity? It is something very fascinating, very wonderful, and it's something highly essential that persists everywhere, from youth to adulthood, even doctors, and I was very eager to find out in which ways curiosity in our youth resembled or had similarities with us as doctors in a profession. So, I hope to have awakened your curiosity to get to know me better. Hello again, my name is Dr. Ay Lie Loa-Hartana. I was born and raised in Germany. I lived there for 32 years. And I'm the mother of two sons at Beacon Academy, Bill and Gran. Bill has recently graduated and Gran is currently in year 9. And they were also born and raised in Germany. And as a child, as a youth, I was a very, very curious child, wanting to learn everything from languages to music, you name it, German, French, English. By the way, I'm curious to know, maybe someone in the audience can also speak a bit of German. Einen wunderschönen guten Tag, ich heiße Sie herzlich willkommen und viel Spaß heute. Okay, so curiosity is something that's really wonderful. And in the end, well, I graduated from the International School of Hamburg, taking higher levels in biology, chemistry, and English, and became a doctor after that, even though it was my lifelong passion to become a pianist. But it didn't work out, and it was a doctor. And even as doctors, we have to maintain and we have to acquire and continuously foster our curious and conscious minds. It is very important, whether in internal medicine, surgery, microsurgery, histology, pediatrics, you name it, neurology, anything. We have to keep learning. It is a lifelong learning process and we cannot stop. So we have to keep learning and keeping this inquisitive mind and gaining knowledge, because that is of utmost importance. While I was preparing my speech for today and thinking, what could I present, I just so happened to be on the phone with my elder son, Bill, who is currently also studying medicine at Ciputa University in Surabaya. And we were having our weekly talks, the usual mother-son 2-hour talks, and oh yes, I did find the connection after this amazing 2-hour talk with my son. Bill was telling me, Mama, wow, you know, in term 1, we are being taught clinical skills straight from the start. And I said, oh, that's cool. It's very different than the older days, my days. Yes, and he goes, we are already being taught how to conduct patient anamnesis, which are medical histories, i.e. asking questions to your patient. For instance, questions regarding the chief medical complaint, questions regarding past medical history, drug allergies, family history, and social history. I said, that is amazing. Continue learning, and I did see the connection from there. And how? Well, the connection is not only between doctors and patients, so the doctor not only asks the patients all the questions in order to help give a treatment plan, but it goes even further. Why? Because patients nowadays also have a lot of questions, and will be posing a lot of questions towards us doctors as well, because patients are very smart. So we as doctors must always be able to give good answers and, well, at least be able to answer the questions that the patient has in mind for us. Furthermore, not only that, doctors will also meet after the case history in order to do investigations and treatments and further medical procedures. And we also have to be able to explain our findings and discuss. That means our inquisitive minds and critical thinking are very important in this aspect. And why? Because we want to save the patient, we want to give the best treatment plan for the patient. And this leads me to a story I have. It's a true story. I hope you want to hear the story. So I will give you a clinical case. And The theme is abdominal pain. So, one day, a 16-year-old girl, she presents with severe abdominal pain, vomiting, and fever. Doctor number 1 says, it's okay, it's nothing. It's just a mild bout of gastroenteritis. Why does doctor number 1 say that? Because this patient has had a long history of abdominal pain and lethargy and vomiting, so it was nothing new. However, doctor number 2 says, no. We must take this seriously and get this girl investigated further. And doctor number 2 brought the girl to the emergency room in a hospital. There, a number of tests were performed: abdominal ultrasound, full blood count test, and other investigations. And lo and behold, the blood test showed highly elevated inflammatory cells. And then the senior surgeon was also called in by doctor number 2 because it seemed to be an emergency. Senior surgeon number 2 performs more tests, and everything was positive. So for like positive pressure, McBurney's point, pouch of Douglas, positive SLR signs, everything showed up and pointed towards an acute appendicitis. Well, within 2 hours' time, an emergency open appendectomy was performed immediately that evening. And what the senior surgeon and the chief surgeon found that night was a highly inflamed, already perforated and ruptured appendix, just on the verge of sepsis, with pus just leaking out, a very difficult positioning, retrocecal, meaning the 7th position, very difficult to find. Well, the doctors completed the surgery, and the girl, the next day, when she woke up in the ward, the surgeons came up and they said, wow, that was a really close call. Yeah. Only 2 hours later, and we would not have made it. Oh, wow. Well, the girl made a complete recovery, and it's standing right here, 29 years later, and it shows, and it highlights the importance of critical thinking, and not only critical thinking, but also a conscious mind, and being courageous, and, just continuing to learn. And yeah, it is a lifelong journey, the learning. I hope that I was able to inspire you with my story, and please keep up the curiosity, and the learning, and courageousness, and consciousness, and thank you very much for everything. That was my story.